So my name's Brian. I'm the practice principal and a physiotherapist at CK Physiotherapy. It's mainly musculoskeletal patients that we see here. So we'll see anything from sports injuries, muscle pain, back problems, neck problems, tendon problems. There are some problems that are often difficult to treat with some of the normal treatments that we actually use. We often use things like some ultrasound, interferential, acupuncture, and then other soft tissue massage, and then joint mobilization techniques. Some of the conditions that I'd use this for are some of the more difficult conditions that we know that are more difficult to treat, like the calcified tendinitis of the shoulder, plantar fasciitis, trochanteric bursitis. They're often difficult as a therapist, and this has been nice to use in. I've been really pleased with some of the results with it, and even after 1 or 2 treatments, the improvement that people have had. It's been interesting how the pain relief often straight away, and the increasing range and movement straight away, and how we can then get them to be doing some functional exercises fairly quickly. Initially I thought radial and focus were exactly the same thing, but after investigating a little bit more, I saw that they weren't the same, that radial isn't a true shockwave, whereas focused shockwave is a true shockwave. A lot of the research that's out there is actually on focused shockwave, not radial shockwave, and that focused shockwave is better for some of the deeper tendon conditions rather than just myofascial. Basically, I thought with a machine like this that I'm going to be able to offer something that a lot of other clinics aren't necessarily offering, that the research is out there to know that it can help with some of those conditions which have often been difficult to treat with physio, as I've been doing it up to date, and to also get some good results with that. And then already that word of mouth is starting to come around a little bit more. I've currently been treating a patient who has calcified tendinitis in the shoulder. We've done 3 sessions, and the results have been remarkable. She'd had lots of other treatment modalities with other physio clinics where it hadn't actually improved, and yet she's now back at the gym pain-free. I've also been quite interested with it in that when you are working on a patient, there's often parts that I wouldn't necessarily go to when I'm doing the manual therapy that we found have actually been uncomfortable or reproducing some of the symptoms, and I found that's been quite interesting because I'm delving a little bit further, a little bit deeper than I would have before. I've also been impressed that there's really it's not that uncomfortable. There's a little bit of discomfort when we're doing the treatment, but the patients are able to tolerate the treatments quite well, and when you actually see the improvement in their range of movement and their pain straight away, they're quite happy to continue with that, and I also like that it's non-invasive. I thought with the piezo wave that it's a treatment modality that isn't offered by many other clinics in the area, and given that some of the research that's coming out with how effective it can be for things, I thought that would be something that would be useful to be able to provide to my patients. As a treatment modality, it is something that is a little bit more of an expensive charge for patients, but we're finding that with the results that they're getting, and they're often not needing as many sessions straight away, that they're quite happy to go ahead and try the shockwave therapy.